Can I just add my welcome to everybody for being here to mark Schizophrenia Awareness Week and to the panel discussion, and thank you, Sandra, and the organising committee for the opportunity to speak here. Could I also please acknowledge Eddie Bartnick, our WA Commissioner for Mental Health, and the WA panel members whom I've only met a couple of. I haven't actually met Jonathan Lahn before, but it's great to hear about you, and I'm looking forward to your presentation. Vivian Kemp, Anne Bates and David Lawrence. Folks, most of you know that this week the state government handed down a historic budget, a budget with an unprecedented funding boost to the community sector of over $604 million over 5 years. Organisations such as MIFWA are being recognised for their role in supporting the extraordinary challenges that people with schizophrenia face every day. In addition, we made a commitment to spend $46.5 million to build or purchase an additional 100 homes in Western Australia for people with serious and persistent mental illnesses who might otherwise languish in hospitals. There was also another $25 million to be spent over 4 years helping to provide personal support to these people so that they can live a good life in their own homes. We're building two 22-bed subacute facilities, one at Rockingham and one at Joondalup, so that we can offer support to people before they become so unwell that they might need to go into an acute hospital, or in fact after they've recovered from an acute illness in a hospital but need additional support before they go home. And there was also a host of other community-based services that were announced for people with serious and persistent mental illness. I can just tell you that I am absolutely thrilled to be part of a government ready and willing to put their money where their mouth is, and with regards to mental health reform in Western Australia. As part of this reform, renewed respect and dignity for people with mental illness is really high on our agenda. Breaking down stigma, ensuring that each person's physical illnesses are also attended to in tailor-made services that are personalised to the individual. Organisations like MIFWA, innovative, flexible, person-centred, are absolutely central to these reforms. UWA's 2001 report, Duty to Care, found that Western Australians with mental illness were 2.5 times more likely to die from a physical illness than the general population. More likely to smoke, more likely to have nutritional deficiencies, obesity and diabetes, and more likely to engage in the high-risk behaviours such as smoking, alcohol and drug taking, and less likely to engage in good diet and exercise. The Health Right project that developed out of that report had today's topic, putting physical health on the agenda as a key area of focus. An initiative that led from this project was the release in 2010 of the clinical guidelines for the physical care of mental health consumers, which I have talked about in the Parliament but never met the author or co-author. And of course, this will assist clinicians to focus on the physical as well as the mental health of consumers. Today, we are asking, how do we unlock the door to physical health for people with a mental illness? We know that the more people are aware of the issue, the better chance we have of finding that key to unlock the door. Only when we all have a common understanding of the issues and how important it is will we really see things starting to happen. So what we're discussing here today really matters. The physical health of people with a mental illness really matters. Strong partnerships are necessary to support those people with the co-occurring problems such as physical ill health, drug and alcohol problems. I can't emphasise too greatly how important discharge planning, better discharge planning is. With a single plan involving families, carers and support agencies, it is such a high priority for us to improve. It is absolutely imperative. Physical health screening, exercise, improved nutrition and smoking cessation can be incorporated into the recovery plans of people with a mental illness. But if the only thing that comes out of today is for each of us to go away and talk about these issues with other people, whether they're health professionals or carers, family or friends, then it will have been a great success. The more that people know, the more they share and the more they work together, the better we get at raising awareness and finding the solutions. I'd particularly like to thank the Mental Illness Fellowship of Australia and Western Australia branch for the wonderful job that they've done in bringing this event together. The government recognises the vital role that organisations like MIFWA have to play in addressing mental health issues. That's why the state government has committed around $755,000 in funding from the Mental Health Commission to MIFWA in 2010 and 11. And Sandra, I want to make it really clear that in case you weren't aware, this will continue through 2011 and 12. But no one organisation and no government can do it all on their own. It takes a whole community to tackle these issues. Partnerships are crucial. Events like today are important in building those partnerships. The more light that we can shine in this area, the more information we can get out there, the less the stigma and the shame that can be such barriers to people seeking treatment, not only for their mental illness but for their physical illnesses too. Ellen Sachs, a distinguished legal scholar and law professor who has had chronic schizophrenia for more than 30 years, said, "Stigma is out there and it makes people feel damaged, lesser. It encourages people to be in the closet when being able to get help is very important." I know that some of you here today have lived that experience. I want you to know that, like MIFWA, one of the government's key priorities is to break down the stigma associated with schizophrenia through education and public awareness. This government established the Mental Health Commission to bring about reform in mental health in Western Australia. The Commission's focus is on strategic policy, planning and purchasing of services, whilst also building the capacity of the sector to embrace change and improvement. I know that the Commission's been working very hard on the major reform program. Foremost in the key principles guiding that program is the government's pledge to do everything it can to ensure that people who experience mental health problems will always be treated with respect and dignity and as equal partners in the treatment and the recovery process. That is why the Commission has taken the time to listen to consumers, carers and stakeholders. I can tell you that as a result of the consultation process, the Commission's future directions will be focused on personalised care and recovery. The future involves working in partnership across the full system of supports and services. We will strengthen early intervention and prevention programs. It's recognised that improving physical health enhances recovery for mental illness. And as such, Access to quit smoking programs, nutrition and physical activity programs will be supported. We will shift the balance of funding programs to favour increased community support. And we will promote education programs to reduce discrimination. Specialist services and other supports will continue to be delivered by a range of providers, including the area health services, private and community providers, and other not-for-profit entities. Equally, other government departments such as housing, education and justice will continue to provide services for people with a mental illness. Ladies and gentlemen, the Duty to Care report pointed out that for people with a mental illness, physical illness was an important issue that should be included in any reckoning of the overall burden of mental illness. We have a lot of people here today who have experiences and knowledge to share. I'm looking forward to hearing about your experiences in raising awareness of this incredibly important issue and reducing the burden. Thank you very much for being here.